In this lecture, we will review ethical issues in research methods. We will review an article by Dr. Saul McLeod entitled Ethical Considerations in Psychology Research. Ethics refers to the correct rules of conduct necessary when carrying out research. We have a moral responsibility to protect research participants from harm. However important the issue under investigation, psychologists must remember that they have a duty to respect the rights and dignity of research participants. This means that they must abide by certain moral principles and rules of conduct. Let's go over what are ethical guidelines. Well, in Britain, ethical guidelines for research are published by the British Psychological Society, and in America by the American Psychological Association. The purpose of these codes of conduct is to protect research participants, the reputation of psychology, and the psychologists themselves. Moral issues rarely yield a single, unambiguous right or wrong answer. It is, therefore, often a matter of judgment whether the research is justified or not. For example, it might be that a study causes psychological or physiological discomfort to participants. Maybe they suffer pain or perhaps even come to serious harm. On the other hand, the investigation could lead to discoveries that benefit the participants themselves or even have the potential to increase the sum of human happiness. If you are ever in doubt as to whether research is ethical or not, it is worthwhile remembering that there is a conflict of interest between participants and the researcher. It is the interests of the subjects that should take priority. Studies must now undergo an extensive review by an institutional review board or ethics committee before they are implemented. All UK research requires ethical approval by one or more of the following: the Department of Ethics Committee, Institutional Ethics Committee, or the External Ethics Committee. Committees review proposals to assess if the potential benefit of the research are justifiable in light of the possible risk or physical or psychological harm. Moving on to informed consent. Before the study begins, the researcher must outline to the participants what the research is about and then ask for their consent or rather their permission to participate. An adult, meaning 18 years or older, capable of being permitted to participate in a study can provide consent. Parents or legal guardians of minors can also provide consent to allow their children to participate in a study. Whenever possible, investigators should obtain the consent of participants. In practice, this means it is not significant to get potential participants to say yes. They also need to know what it is that they are agreeing to. In other words, the psychologist should, so far as is predictable, explain what is involved in advance and obtain the informed consent of participants. Now, informed consent must be informed, voluntary, and rational. Participants must be given details to make an informed decision, including the purpose, procedures, risks, and benefits. Consent must be given voluntary without undue coercion, and participants must have the capacity to rationally weigh the decisions. Now, Participants must be given information relating to the following: a statement that participation is voluntary and that refusal to participate will not result in any consequences or any loss of benefits that the person is otherwise. All foreseeable risks and discomforts to the participant, if there are any. Procedures involved in the research. Benefits of the research to society and possibly to the individual human subject. Length of time the subject is expected to participate. Person to contact for answers to questions or in the event of injury or emergency. And subjects' rights to confidentiality and the right to withdraw from the study at any time without consequences. Okay, let's move on to the topic of debrief. Debriefing after a study involves informing participants about the purpose, provided an opportunity to ask questions, and addressing any harm from participation. Debriefing serves an educational function and allows researchers to correct misconceptions. It is an ethical imperative. After the research is over, the participant should be able to discuss the procedure and the findings with the psychologist. They must be given a general idea of what the researcher is investigating and why, and their part in the research should be explained. Okay, moving on to protection of participants. Researchers must ensure that those participating in research will not be caused distress. They must be protected from physical and mental harm. This means that you must not embarrass, frighten, offend, or harm participants. Normally, the risk of harm must be no greater than an ordinary life. For example, participants should not be exposed to risks greater than or additional to those encountered in their normal lifestyles. Okay, moving on to deception. Deception research involves purposely misleading participants or withholding information that could influence their participation decision. This method is controversial because it limits informed consent and autonomy, but can provide otherwise unattainable, valuable knowledge. Types of deception include deliberate misleading, for example, using confederates, staged manipulations in field settings, or deceptive instructions. And the next one is called deception by omission. For example, failure to disclose full information about the study or create an ambiguity. The researcher should avoid deceiving participants about the nature of the research unless there is no alternative. And even then, this should need to be judged acceptable by an independent expert. However, some types of research cannot be carried out without at least some element of deception. And I have a video lecture for you in regards to the Milgram's study of obedience and the Ash studies that I want you to view. Moving on to confidentiality. Protecting participant confidentiality is an ethical imperative that demonstrates respect, ensures honest participation, and prevents harms like embarrassing or legal issues. Researchers must clearly describe to participants the limits of confidentiality and methods to protect privacy. With internet research, threats exist like third-party data access. Security measures like encryption should be explained. Okay, moving on to withdrawal from an investigation. Participants should be able to leave a study anytime if they feel uncomfortable. They should also be allowed to withdraw their data. They should be told at the start of the study that they have the right to withdraw. They should not have pressure placed upon them to continue if they do not want to. And that is a guideline flouted in the Milgram's research. Participants may feel they shouldn't withdraw, as this may spoil the study. Many participants are paid or receive course credits. They may worry they won't get this if they withdraw. Even at the end of the study, the participant has a final opportunity to withdraw the data they have provided for the research. Now let's talk about ethical issues in psychology and socially sensitive research. There has been an assumption over the years by many psychologists that provided they follow the BPS or APA guidelines when using human participants, and that all leave in a similar state of mind to how they turned up, not having been deceived or humiliated, given a debrief, and not having had their confidentiality breached, that there are no ethical concerns with their research. But consider the following examples. Quarterly in 1994 found that middle-class children in daycare at an early age generally score less on cognitive tests than children from similar families reared in the home. Assuming all guidelines were followed, neither the parents nor the children participating would have been unduly affected by this research. Nobody would have been deceived. Consent would have been obtained, and no harm would have been caused. However, consider the wider implications of this study when the results were published, particularly for the parents of middle-class infants who are considering placing their young children in daycare, or those who recently have. Another example is IQ tests administered to Black Americans show that they typically score 15 points below the average of white Americans. When Black Americans are given these tests, they presumably complete them willingly and are not harmed as individuals. However, when published, findings of this sort seek to reinforce racial stereotypes and are used to discriminate against the Black population in the job market, for example. Now, Schreiber and Stanley in 1988, the main names for socially sensitive research, outlined 4 groups that may be affected by psychological research. It is the first group of people that we are most concerned with. First, members of social group being studied, such as racial or ethnic group. For example, early research on IQ was used to discriminate against U.S. Blacks. Second, friends and relatives of those participating in the study, particularly in case studies, where individuals may become famous or infamous. Third, the research team. There are examples of researchers being intimidated because of the line of research that they are in. And fourth, the institution in which the research is conducted. Now, 4 main ethical concerns when considering would be: first, the research question or hypothesis; second, the treatment of individual participants; third, the institutional context; and fourth, how the findings of the research are interpreted and applied. So again, terms to know for your upcoming quiz. Ethics is defined as the branch of philosophy that investigates both the content of moral judgments, and we're talking about what is right and what is wrong, and their nature. For example, whether such judgments should be considered objective or subjective. And ethics is the principles of morally right conduct accepted by a person or group to considered appropriate to a specific field. And in psychological research, for example, proper ethics requires that participants be treated fairly and without harm, and that investigators report results and findings honestly. Research ethics is the values, principles, and standards that guide the conduct of individual researchers in several areas, including the design and implementation of studies and the reporting of findings.